Hello, welcome. Today's topic is dental decay, a pretty common problem. Dental decay is cavities or caries or what we all know as fillings, for example. And I'm just going to give a little bit of a brief background and some information about how us dentists treat decay and what we can do to prevent it. Still kind of some of the same true and tried methods out there. So dental decay is a bacterial infection. It can be transmitted from person to person, obviously using some sort of mouth interaction, kissing, things of this nature. And mostly we have a few different ways to treat decay. We can alter the bacteria, we can alter the structure of the tooth, and we can try to alter behavior. So let me get into those. So altering the bacteria, the first one I referenced, is basically breaking up the bacteria. That's your brushing, your flossing, your water pick, your any kind of home adjunct. And what that basically does is it tries to remove the biofilm. Biofilm is what forms from the bacteria. It's basically that layer on your teeth. Biofilm hardens up into plaque and tartar. This is what you read about. But what the ideal scenario is, you break up the bacteria prior to it hardening up, when it's still in that stage called the biofilm. So we've tried to break up the bacteria mechanically. We can try to kill the bacteria. That's what we use fluoride. We have medication called chlorhexidine. We also have things called thymol, and we have actually sodium, basically bleach. We have low concentrations of bleach that people use to try to rinse with. I don't recommend people running out and rinsing with bleach or chlorine or hydrogen peroxide. I've heard all these being done, and these have to be monitored and done properly with certain formulations of that. But these are all ways we have to try to kill the bacteria. We can also try to change the environment that's in the mouth. Basically, we're trying to make the mouth more basic, less acidic. We have medications. We have something called xylitol, which is mostly found in gum. Xylitol is spelled Xylitol. We also have probiotics. This is sort of an up-and-coming part of dentistry, actually not very far from here in Gainesville, Florida. There is a researcher, I forget his name, he's a PhD researcher, and he has a company called Evora Pro, or I think his product is called Evora Pro. I think his company is called Origenics, if I'm correct. But basically what Evora Pro is, it's a probiotic, it's a good bacteria that you chew up a tablet, and the idea is that if you put good bacteria in your mouth, it overpopulates and doesn't let the bad bacteria cause the cavities. This is similar to probiotics when people eat yogurt or things like that to change the bacteria in their gut or in their stomach. So we talked about how we can try to alter the bacteria. We can also try to alter the structure of the tooth. This is something we do pretty commonly. Most of what you know about is fluoride. Again, I mentioned fluoride earlier because it can kill bacteria, but fluoride has another advantage in that it hardens tooth structure. A lot of different opinions about fluoride. I'm not going to get into that conversation. I'm just telling you fluoride does harden teeth. We can try to remineralize teeth. So we have a tooth that's started to break down the bacteria. The acidity from the bacteria has started to soften the tooth. We can try remineralizing it, again, using fluoride. Another product called MI-Paste, MI-Paste, which has a product called Recaldent, RE-CALDENT. And this is something that goes in and tries to remineralize the tooth. I've also heard of things called ozone therapy. I don't know much about it. And this is another method of trying to harden the tooth back up. I will tell you from practical experience, I have not seen this to be very effective. I'm talking about MI-Paste or ozone therapy. I've heard of it. I know some people do claim that it works, especially around orthodontic brackets. I think there may be some areas that MI paste does work, but to see a lesion and put some paste on there and see that lesion disappear, I have not yet witnessed that. So maybe I need to see that, but I have not yet. We can also coat the surface of the tooth. We all know this as sealants. Still kind of the gold standard. As children, we like to seal teeth. I encourage it for all my kids that have newly erupted adult teeth at around 6 years old is when that starts. And so let's just summarize what I had to say. Really the best ways that we have to prevent cavities is still diet, avoiding sugary foods, sodas, acidic foods, fluoride, sealants, and good home care, brushing, flossing regularly. The next step down, which is what I'm going to call in the good category, that's going to be xylitol, chlorhexidine, thymol varnish. There's a new product called Cervitec Plus, CERVITEC Plus. This is a varnish made with chlorhexidine and thymol. Thymol is THYMOL, showing some positive research. I don't know too much about the product. Everything else that's out there is kind of still in its exploratory phase when it comes to the probiotics or the ozone therapy and stuff like that. So ultimately what I have when I have a high caries risk patient, we try to change their behavior. That's very difficult. Some people it's tough to change people. We have high fluoride toothpaste. We use ClinPro. There's also another product called Floridex. There's lots of different products out there that are a high fluoride toothpaste. Usually high fluoride toothpaste has 5,000 parts per million. You'll see 5,000 ppm on the tube, which is about 5 times more. Most toothpaste have around 1,000 to 1,500 parts per million. The prescription toothpaste has 5,000 parts per million. We can apply fluoride varnish on these patients when we see them every 3 or 4 or 6 months. And then we encourage them to consider some sort of adjunct at home. Maybe xylitol gum would be my next advice. Usually xylitol gum, you want to get 5 grams a day, usually by chewing 5 1-gram pieces of chewing gum throughout the day. And you don't want to get more than 5 grams. I've heard that xylitol can cause some stomach upset, so you'd have to research exactly how to get it. Most of the time, the xylitol gum has to be purchased online. I think Epic, EPIC, is probably the most common brand that I see. I'm not sure if you can get it at a local health food store, but online they're very readily available. Thank you. Good luck.